This video will be very interesting both from patients who can learn more about why physicians prescribe certain medications, as well as physicians to get a better understanding of published studies and what those studies actually show to help decide what to prescribe to patients. A common concern that I hear from patients when I put them on a drug for cholesterol is, I can't take a statin because I have dementia and statins cause dementia. Or I refuse to take a statin because I'm worried about dementia that happened to my mom and statins cause dementia. This is the farthest thing from the truth. Statins do not cause dementia. Statins have never been shown to cause dementia, but it is a very common thing that I hear and that physicians hear in general. Misinformation spreads far better than true information. That's part of the reason I put this video series together, is for both patients and physicians to learn a little bit more about where this information comes from and to hopefully get truth to people's brains so they realize what's actually happening. So where did this come from? Why do patients say statins cause dementia? Well, they read it somewhere, they saw it on TV. When we do studies, there are studies called prospective studies where you give people either a drug or a placebo, which is nothing, and you look to see which outcome is better, or retrospective studies where you say, let's look at patients that have dementia, for example, and then once you take 1,000 patients with dementia, look to see what drugs those patients are taking. Well, retrospective studies in patients that have dementia, they're more likely to be on a statin than if you're not on a statin. Well, does that prove that statins cause dementia? No, it just says that people that have dementia are more likely to be on a statin. Well, if you look at those patients, people with dementia are more likely to have risk factors for vascular disease. They're more likely to be smokers, they're more likely to be diabetic, they're more likely to have hypertension, and they're more likely to have high cholesterol. So people with dementia are actually more likely to be on diabetes medications, blood pressure medications, and cholesterol medications, all three of them, not just statins. So to prove whether or not it's an association or causal effect, what needs to be done is you need to take patients who don't have dementia, put them on a statin or give them nothing. Don't tell the patient what they're getting. Don't let the physician know what they're getting. So the only people who know what the patient's getting is the trial center. The trial center only gets data once the study is done and then determines who actually developed dementia, who didn't develop dementia. In all of the trials looking at statins, where dementia was an outcome that was looked at, statins are very good at actually preventing dementia. It makes sense. Dementia is caused by the most part when people develop vascular disease in the brain. As you develop more advanced vascular disease, you get less blood flow to the brain, neurons die, and people develop dementia. Well, drugs like statins, we know slow the progression of vascular disease, so statins theoretically should decrease the risk of dementia. And the blinded prospective trials have shown that statins do decrease the risk of dementia. There are frequent ads on television and other media for supplements that have been proven to decrease the risk of dementia. If you look carefully at those ads, the bottom of the ads clearly state that whatever the supplement is has never been shown to have any clinical benefit. So despite the fact that it's advertised that it decreases dementia, it also has no data to support that it decreases dementia. It's very easy to find 5 people or 10 people and give them a drug, have them think they feel better on the drug, and then go out and try to sell the drug to the public. If they were to prove that their drug decreases the risk of dementia, they would have to do a blinded prospective trial, as I described with statins. And if that drug showed a lower risk of dementia, then that would be great. Unfortunately, none of those drugs that you see advertised on TV or those supplements that are proven to cause dementia because they have spokespeople to say that it helped them, those have never been proven to decrease the risk of dementia. And patients take millions, if not billions of dollars of those drugs, where we have simple drugs like statins, which we know decreases the risk of dementia, that cost far less and insurance covers the majority of the cost of those drugs. I hope you enjoyed today's video. Have a good afternoon. This may be slightly controversial, but if you have questions, post them in the comments. I'd be glad to reply to the comments anytime.